Hello, good morning. Am I audible?
Yes, sir, you are audible. Just give us
Yeah.
2 minutes.
So
We are
by the
sharing your
time
PPT.
my slides are ready, so let me thank the organizer for giving me this opportunity to speak in front of you. And today I'm going to talk about the basic simple techniques which anyone can use to motivate the uh, persons who are using substances and to understand the basics related to substance use. Some of the techniques are widely used by the clinical psychologists, mental health professionals, and social workers. And so I'll start with my presentation. So we'll see what are the psychosocial interventions can be used in substance abuse management. Next, please. Next. Yeah. So basically, psychosocial interventions are designed to help the client. So by understanding and clarifying their problem. So this is very important. People think counseling means to to make the patient understand their problem. That's true. But before that, the counselor has to understand the problem of the patients or the clients. So this is very important. So the focus of the counselor should be on the understanding of the problem of the client rather than to teach him or to preach him. And that part can come later on. But initially, our focus would be on the understanding. So if we try to understand, it will definitely help us in establishing rapport, to show empathy. All these things will be done automatically if our focus is to understand the client. But if our focus is into deliver techniques or a particular type of therapy, then we are basically delivering techniques or therapy, nothing else. So then the psychosocial intervention basically helps us to learn how to reach their goals through meaningful, well-informed choices and to assist in resolving the issues related to patients. And so this to understand the problem. So this is psychosocial intervention is basically related to understanding of the client's problem. So keep this thing in mind. Next slide, please. Yeah, so you can see that the counseling can be given in various settings and by various types of people, various professionals they can give. And not only professionals, the laymen, the priest, the uh, religious people, the leaders, the family members, the friends, they can also give, but to certain extent, not the like the complete sessions can be given by the family members or friends. Next, please. Next slide. Yeah, so let us see the important characteristics of the counseling. So it must be uh, objective. So there is a less scope of subjectivity. The counselor should be calm and supportive. The counselor should be non-judgmental. We all know that. And the counselor should be genuine. Here, genuine means like the counselor should not try to behave like an actor or actress. He should be in his own sense. And the like the true self should be used during the counseling session rather than like using very accented language and other ways to impress the client. Those are not advisable in counseling sessions. Next, please. Next, yeah. So there are certain misconceptions about psychosocial interventions. So make it clear that psychosocial interventions are not just talk therapy, though you may find somewhere written in the textbook also it is one type of talk therapy. Though this is delivered through the communication or language, but it is not just talk therapy. It is not preaching. It is not imposing one's own value on the client. If you think uh, drinking alcohol is bad or immoral, but you can't uh, impose such thing on the patient and tell that, this is against the religion or against the society or against your or whatever social norms are there. So then this is counseling is not over involvement with the client. Sometimes counselor think that with the love and affection they can treat the client. No, this is not true. And counseling is basically not argument. You are not trying to prove your point. And counseling is not about making lie or false promises to the client. Like sometimes counselor initially tell the client that yes, we can cure you or we can treat you. You will be completely all right. So such false promises should be avoided. And the counseling is not like business like attitude. Next, please. Yeah, so coming to the specific type of psychosocial intervention. So first one is psychoeducation. And then we can talk about motivation enhancement, and the relapse prevention support group will not cover in this presentation. So basically, I'll talk about psychoeducation and motivation enhancement, which can be done by expert psychologists also, and anyone who is interested and have some basic understanding about the psychology of human being. Next, please. Next slide, please. Next, please. Next. So what is psychoeducation? So it is basically a process to provide the client and his caregiver with basic information about the problem and what type of treatment is offered. It also covered about the prognosis and prevention and rehabilitation. The information helps the client and caregiver to understand the symptoms and the nature of the illness, to understand possible course and outcome of the illness, to understand the nature of prescribed medication and the possible side effects. Like medications are very important to manage the withdrawal symptoms or to make the process of quitting painless. Develop strategies to help ensure medication adherence, and understand recovery and importance of establishing a recovery goal. Next, please. Yeah, then when it can be given, so psychoeducation will be given at the beginning of the treatment, just after the assessment, or it can be part of the assessment also. Like during the assessment also, you can give in between the psychoeducation, correct the belief of the patients, or once you complete the assessment, your intervention will start with psychoeducation. It can be given at clinic, it can be given by mental health professionals, counselors, field workers, social workers, and it must be given to patient as well as their family members. Next, please. Yeah, so let us see the elements of the psychoeducation. Generally, we say that we are giving psychoeducation, but being the counselor, sometimes we are not aware what we are delivering. So see, what are the elements? So we must focus on this thing. These components must be delivered during the session. Like we must explain the nature of the illnesses in detail. Even though the symptoms are not there in the patient, we should explain those symptoms. And then treatment modalities, various treatment modalities. Never say that you do not require medication and I can treat you with counseling. And never say you will be treated with only medication, no need to counseling. Because it has been seen in the research, both the treatment modalities are required very much. Then other treatment modalities also supportive treatment, 12 stage phase program, and and certain groups, Alcoholic Anonymous or others, Narcotic Anonymous type. So all treatment modalities should be explained and their requirement when it is required. So in maximum time, physical or pharmacological treatment is required first with the counseling. Then treatment duration, you must explain about the treatment duration. It's not that it is just 1 month thing or 2 month thing. So you must be very giving factual information about because all addiction problems, all substance use disorders are chronic relapsing illness. So telling them that it is just a matter of few months is telling lie. So explain this thing. This is the illness which is chronic and relapses are very common. Then need for active participation in treatment is very much required. So you highlight this thing, emphasize this thing. If family members as well as patients, they both are actively involved in the treatment. Next, please. So under the nature of the illness, you can explain several things depending upon the substance use. Like for opioids, there are other things, whereas for alcohol, you can use the things related to the substance. Then treatment modalities should also be related to the substance use. Next, please. Next. Yeah, then duration, about the duration also, like for opioids treatment, it is a very, very long duration, whereas for tobacco or other things, it could be less duration, but we do not know. So depending upon the client and his past attempt of abstinence, and you must, as I told, emphasize the active participation in the treatment. Next, please. So psychoeducation can be delivered in individually or in group setting, but it is better to use the family member with the patient also most of the time. Some of the information should be given to family members only. So can be delivered by a counselor, doctor, or even a peer person. So psychoeducation can be given by the friend, by family members also, and delivered before the beginning of the treatment and at periodic intervals to reinforce the messages. So in between the treatment also, you have to, like sometimes what happens, patient learn few skills and then forget also, or patient get information, but after some time the forgets also. So you have to check this also, and in between that intervention, you have to give psychoeducation also. And as I highlighted, it must be given patients as well as to family members. So patient and family members both should need the psychoeducation. So it must be delivered to both. Next, please. Yeah, coming to motivation enhancement therapy. So here basically we focus on the motivating the patient for the treatment. Next, please. So there are certain things related to the motivation. So there are lots of undesirable behavior we are having, like eating junk food, less physical activity, drug use, spending a lot of time in TV and video games, unhealthy diet, not spending time with. So all these are undesirable behavior, and we never focus on such behavior. So changing such behavior is basically require lots of motivation. Next, please. Next. So if we want to achieve certain desirable goal, like if we want to eat healthy only, or if we want to do regular exercise, if we avoid drug use, so all these things are related to understanding and then motivation about the about our behavior. So we want to change the behavior, or we want to remain in the same behavior. Even though we want to change, are we doing enough efforts, or putting enough efforts to change the behavior? Next slide, please. Yeah, next, please. So basically, motivation is the key to change the behavior. So undesirable behavior can be changed to desirable behavior. Undesirable behaviors are like which we do not want, but which we are keep doing on. For example, procrastination, not doing exercises, lying down on the bed maximum time. And desirable behaviors are doing physical activities and of spending time with family members. Next, please. Yeah, so if we want to change our undesirable behavior to desirable behavior, we are having certain stages of motivation. So if we are in pre-contemplation stage, we may not think there is a need to change. Okay, we are in the denial mode. We think everything is fine. For example, the person who is taking or drinking alcohol and having lots of problem related to alcohol use may not think or may not feel that there is a need to change his behavior. Whereas at pre-contemplation stage, the person is ambivalent about the changing, and at preparation stage, patient or we take some steps to change. We plan, we think, okay, from tomorrow or after 1 month, we can start this activity. In action stage, basically, we are doing all those desirable behaviors. And at maintenance stage, we are maintaining those desirable behavior. In case of substance use, in action stage, the person is under treatment, and in maintenance stage, person is not taking substance, he is abstinent. Next. Yeah. So this happens after maintenance stage. Yes, keep it, no issue. After maintenance stage, there is a high possibility, because the nature of the illness is like that, the person may relapse. So once there is a relapse, the person may again go back to any of the three stages, like pre-contemplation, contemplation, or preparation. Next, please. Next. Next, I have explained, so just skip all these slides. Next, please. Next, 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 next. Yeah. So now let us discuss about the techniques which can enhance our motivation or enhance motivation of the patient. So basically, we are discussing about 4 techniques. Next slide, please. Which basically helps us in enhancing motivation of the, next slide, please, of the patients. So there are various techniques to enhance motivation and or therapies. One is called brief intervention. Another one is like motivational interviewing, then motivation enhancement therapy. So under brief intervention, these 5 techniques are 6 techniques are very important. So acronym is FRAMES: feedback, responsibility, advice, menu, empathy, and self-efficacy. So feedback is related to the patient's functioning, or if whatever consequences of the substance use are there in this particular patient, we give feedback to that about that only. Suppose in case of alcohol, if the liver functions are deranged, so we will tell the patient that your liver functions are deranged, your liver is getting damaged. Okay, we do not say the patient that you are taking alcohol, so you may develop you will be developing dementia, you will have cancer, lung cancer, or anything. So not all sorts of information is given to the patient under feedback. Feedback means whatever consequences patient has recognized or patient has told during the history taking, or whatever information we have collected through assessment or investigations, We just give feedback about those things. Under responsibility, we tell the patient that to change or not to change is the responsibility of the patient. The counselor's job is to help the patient if the patient wants to change the behavior. Advice is like counselor generally say that this is harmful for you and you have to quit. And there are certain methods to quit. Menu of options means the client counselor tells the patient that there are various options of treatment. So whatever patients want to take, patient can have. For example, various options means inpatient treatment, outpatient treatment, taking just counseling from the counselor, or getting medicine only. Like we all know that empathy is very much required for any type of treatment, and we focus on the improving the self-efficacy of the patient. We support the self-efficacy because most of the time, due to several relapses, patient's self-efficacy becomes very low. So we support it. We tell that you can do it. It's possible. Next slides, please. Next, 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 next. Yeah. So under motivation enhancement therapy, we again use 4 techniques: feedback, decision balancing, developing discrepancy, and supporting self-efficacy. Feedback and supporting self-efficacy we have already discussed. So let us see the decision balancing. What is decision balancing? So next slide, please. So basically we ask the patient to see the benefits of if the patient is remaining same or changes his behavior or a behavior. Next slide, please. And we also ask the patient to weigh the consequences or cost he has to pay for if the patient remaining same or patient try to change the behavior. Please change the slide. Yeah, next, please. Yeah, so benefits of change vis-a-vis benefits of staying the same. So the patient will compare it with the cost of staying the same vis-a-vis cost of change. So what happens when you ask the patient what are the benefits of taking a substance? So patient generally will say no benefits. So you have to help the patient to find out the benefits. It might be helping the patient in reducing the tension, or it gives pleasurable effect, it relaxes the patient. So all these things are benefits of using the substance. Then cost of using the substance, like money loss, psychological loss, physical health loss, damage, or the reputation in the society is damaged. So all these things. So after noting down all the things, you ask the patient which one is more cost or benefits. So let the patient decide. So here the counselor's job is to help the patient to find out or to see the consequences of substance use. You can also say that uh, wise, wise people can behave or do such things which are having more benefits than loss. Next, please. Next slide, please. Yeah, so this is one example of weighing the cost and benefits of the substance use. So this matrix can be applied to any behavior which is undesirable, and you can think upon the benefits and cost you are paying. Next slide, please. Yeah, next technique is developing discrepancy. It is basically like when the person was not using substance, how was he, and what happened after the substance use. So basically, after substance use, patients like lots of consequences, negative consequences are attached with the substance use. So you can say that it's like his dreams like he wanted to study, but what happens when he started taking substance? Or he wants to remain healthy, but what happens when he started using substance? So now he's not healthy. Earlier his reputation was there in the society. Now there is no reputation. Earlier people were using Mr. or G with his name. Now they're like pronouncing his name in different way. They have given certain other names. uh, Next slide, please. Next, please. Yeah. So so here, supporting self-efficacy. So these two statements are there, that the goal is achievable and you can do it. So here the counselor's job is to help the patient to understand these things, not to tell these statements, you can do it. Rather, the counselor's job is to find out the some example from the past. For example, that oh, last time you have quit for a month, it means you have the ability, you can do it. So that way you have to get the examples, explain it to the patient, so it will help the patient in understanding. Next slide, please. Yeah, so I conclude the presentation. Like, motivation is the internal desire or drive to change one's behavior. Motivation is the key to change one's behavior. And the motivation is, we all know, that dynamic phenomena, and the therapist or counselor can help the patient or client to change his or her behavior. Behavior change occurs through various stages, and the motivational interview uses various elements like frames, then behavior, then motivation enhancement therapy, motivational interviewing. Thank you. Next slide, please. Yes, my presentation is over. Thank you. Hope I have finished within the time.
Yes, sir. Thank you so much. Uh, Thank you, sir, for giving such a wonderful insight on management of addiction. Sir, we have a question from one of our participants.
Okay. Please read the question.
Yes, sir. So Mrilani has asked what we should do primarily to calm hyper undergraduate students.
Okay, so this is, I don't think this is directly related to my presentation, but anyway, like, we have to, as I started my presentation, counseling doesn't mean you have to teach the client something. Rather, your job is to understand the client. So you have to understand why the undergraduate student is hyper. So once you like talk to the student, you will understand that there might be certain factors. There might be certain events in the environment. There might be certain provocations from the environment he might be getting. Or the student might have certain mood related issues. So you have to assess. So after assessment, you can plan intervention accordingly. And sometimes this hyperactivity is due to attention seeking also. So without assessing, you can't advise anyone for doing this or that. So if the case is more explained, then I could tell the so thank you.
Thank you, sir, for answering the question. Thank you so much for joining us and sharing your insight on and answering the question of our participants. We are really grateful that you spared your valuable time and joined us.
Thank you.
Uh, Sir, So there is one more question, if you can answer that. So can you hear me?
Yes, yes.
Yes, sir. Uh, so Rakesh sir has asked, which is better
Yeah.
place for de-addiction, drug de-addiction center or inpatient department of psychiatry?
Okay, I think this is very good question. So in my one of the slide, I have mentioned that the treatment can be delivered at any place. Okay, in one of the slide I have mentioned. So, but the facilities must be there, like the medicines must be there, the counselors must be available, the social workers must be there to manage all these things. And now in most of the medical college, there is separate section for de-addiction, or de-addiction centers are separate from the main hospital sometimes. Like our center, AIIMS center, is located in Ghaziabad, whereas main hospital of AIIMS is located in Delhi. So it depends upon what type of facilities you want to provide to your client. Like we have very big campus, green campus, so lots of facilities for the patients. Whereas the center in medical colleges, where just one ward is given to for de-addiction, so their patients are not having much facilities. So, but these interventions can be provided at any place. There is no such restrictions. But if the place is having well equipped, it is the best one. Thank you.